Hello everyone. This week is all about knee pain, specifically knee pain with going downstairs and knee pain with hiking downhill. We're going to start with some of the anatomy first just to get you oriented, and then we're going to talk about one of the most common causes as to why this happens. So if we zoom in and look at what happens through your joints as you're going downstairs, there are a couple of really key things here that I want you to notice. The first thing is how your knee moves over your toes, okay? There's a lot of myths out there about your knees going over your toes being bad for your knees. That's not true. You can look into my other post and understand a little bit more about where that myth came from, but what we now know is knees going over your toes is a very healthy, normal part of joint function, all right? So your knees are going over your toes, and what happens when you do that is this black line here indicates your shin bone. And I want you to see how when you first started going downstairs, your shin would have been more vertical. And as you start to progress forward downstairs, the shin angle needs to change, okay? Now what can happen is if from a mobility perspective, if this joint motion is blocked, so if your knees aren't able to progress over your toes, that can lead to an increase in stress and strain through the front of the knee with going downstairs. And you might be wondering, okay, well, what do I need to do if I'm having this sort of issue? And this ties us to actually ankle mobility. So the mobility of your ankle joint directly influences this. That's because it is your ankle joint that controls how easy or how challenging it is for your shin to progress forward and for your knee to progress forward. So oftentimes what will happen is a compensatory strategy is someone's heel will pop up as they're going down the stairs, or they'll have some pain in the front of their knee. Either one of these can be symptoms of needing more ankle mobility overall. If you're interested in learning more about how to check your own ankle mobility as well as some exercises, definitely go to my bio and subscribe to my newsletter this month. It's going to have more information on this on even more detail. But for now, let's talk a little bit more about what from a muscular standpoint can cause these ankle mobility restrictions so that you can have more information to start to improve this on your own. So if we zoom in and look at the ankle joint itself, what's happening through the ankle and the knee as you're going downstairs or hiking downhill, you'll see the shins moving forward, right? And what happens there is two different things really we're gonna think of this as like a mobility sandwich. So we've got things on this side and things on this side. So one, what has to happen is this calf muscle has to stretch open. As your knee goes over your toes, this calf has to stretch open. So calf tension or calf muscular restrictions can be one reason why someone has some difficulty with this type of movement. Now, interestingly, you have two calf muscles. Well, you have a lot of calf muscles, but there's two main ones that we're going to focus on. This one called your gastrocnemius, that calf muscle stretches more when your knee is straight. This underneath layer called your soleus, that's the one that's really important when it comes to ankle mobility, because when your knee is bent and your knees are going over your toes, this is the muscle that really has to stretch open. So a lot of the traditional calf stretches that you'll see of like putting your toes up the wall and stretching your calves with your knees straight, that type of thing, while those are, good in their own right, they're not necessarily targeted towards improving your ankle mobility because it's actually targeting a different calf muscle. So it's really important if you're working on ankle mobility that you have things in your program, in your routine that include working the ankle when your knee is bent, because ultimately that's how you need to use it when you're going downstairs or hiking downhill, okay? So now I mentioned this is a sandwich, right? We got to talk about both sides. So we talked about the calf muscle stretching. The other thing that's really important is you have a muscle in your shin called your anterior tibialis. And what that muscle does, it's one of your shin muscles. So if you've ever had shin soreness or shin splints, this can be one of the muscles that causes it. It's not the only one, but just to give you a feeling of what that muscle might feel like. When your knee goes over your toes, this is one of the really important muscles that helps control that motion. Just like your bicep helps you control picking things up and doing bicep curls, this muscle helps you control your knees going over your toes. So if you're working on improving ankle mobility, it's important that you have things that open up the back of the ankle and calf, but also strengthen the front of the knee and shin and ankle, because ultimately this muscle is really the superstar when it comes to improving ankle mobility. So as this mobility improves, what happens is your shin's ability to go over your toes increases. increases, which can decrease the amount of pressure going through the knee when you're going downstairs, okay? Now, this isn't the only reason someone can have knee pain with going downstairs or going downhill. We're gonna be talking about more of those this week, but this is one of the most common causes. Now, again, if you're interested in learning more about how to screen this on your own, I definitely recommend that you subscribe to my newsletter this week. I'm diving into this in full detail. I hope this is helpful. Let me know what questions you have, and I look forward to diving in with all of you again soon.